Welcome back. You're watching South Africa Tonight here on eNCA. The discovery of the Omicron variant sparked panic in other countries. South Africa has incorrectly been labelled as the country where the variant emerged, and many countries have slapped travel bans on us and other neighbours. The United Nations has slammed travel restrictions against any Southern African country, while the World Health Organization's regional COVID-19 incident manager joins us this evening to weigh in on this. Thank you so much for your time, Dr. Balde. We appreciate it. Speak to us about how serious the situation is with regards to Omicron and how it's spreading on the African continent.
Thank you for the opportunity. As we have seen, during the past 10 days, the situation is quite very serious, given the number of the mutation which has been really reported from South Africa. And we really commend here all of the work, the surveillance work, which has been done by the South African, the scientific teams for really preventing and informing the entire world around, this new variant. And the World Health Organization took all of the different appropriate measures for really passing that message, and also to support countries, and notably in Africa here, for detecting the Omicron, in the samples that they have been collecting over the past few weeks in order to detect, potential, presence of the Omicron. At the moment, and as by Friday, last Friday, on the 3rd of December, there was almost 38 countries, across the world, around the world, which has reported the Omicron variant. And so we can see that it's not really something which is confined or really isolated in some of the African countries, but it's really a kind of situation which has been reported in all of the countries in the world. We have seen, given the evolution of this pandemic over the past 2 years, that a different variant can emerge from different parts of the world, and this is just to again, to remind us that the virus do not really know any border, any border from one country or another.
Yes, sure. I just want to let our viewers know that there is about a 10-second delay during this live, so just bear with us in terms of those answers.
I'm not hearing you.
Let's just quickly ask you, Doctor, with regards to how South Africa is still being stigmatized and labelled as the country where the Omicron variant emerged from. How important is it for the World Health Organization to try and protect countries that are being labelled as where the variant emerged from because of the devastating effects that this causes? For example, travel bans and the stigmatization, not just on South Africa, but Southern Africa.
Yes, the World Health Organization really stands with African nations, which has made these very timely and honest, actions for sharing the information around this new variant, which is a kind of global, public health threats. It's not only, a threat for African countries, but for the entire world. And by sharing those information, this has allowed all of the different countries to take some of the appropriate measures. But now, this being said, we know that the WHO really do not really recommend those blanket travel restriction or also the stigmatization regarding some of the countries. That's really not what WHO recommend. At the contrary, the World Health Organization really commend that the countries really apply some kind of very rational and proportional and evidence-based intervention, for protecting the population and for protecting the entire, let's say, humanity, community. So those interventions are really some kind of very much targeted, like testing measures, at the departure or the arrival of some of the travelers, or also maybe the implementation of the quarantine measures. So those are really the kind of very targeted and specific intervention that WHO is really commending. Again, I do think that now, given the time, all of the countries which has really imposed these travel bans, these blanket travel bans, will come back, to a good reason, and therefore, obviously, to lift those measures as far as, we are really collecting more information around the transmissibility and severity of this new variant.
Sure, and just lastly, Doctor, is there really any way of identifying where a variant emerged from? And the reason why I ask this is because there's a very dangerous game that countries are playing at the moment. It's almost as though there's a blame game to say, well, Delta came from India and now Omicron came from South Africa, when that's not necessarily the case. Nobody really knows where variants emerge from, and it's rather to say, let's all hold hands and try and work through this. How dangerous is it for countries to play this blame game, and how do we actually say where a variant emerged from?
It's quite really unfortunate, I mean, this remark that you just made, and I think this has just to bring us to a better reasons, I mean, and then the importance of really having a kind of more articulated and more intelligent, I mean, discussion across the world, across the region, you know, for really trying to understand all together, collectively, I mean, the impact of these variants. You are right, I mean, by mentioning that really no one really know where those variants are really emerging. It's the surveillance system which has been put in place in different countries, which will help us to detect some of them, and then to do a kind of, background check to see if the variant was also present in other countries. So this stigma, definitely, it has a lot of implication, lot of effects, I mean, both the health effect, but also the social, the economic, and the political effects. So at this point, I really commend that we all, that's why we have these regional bodies, this regional organization, this global organization, where countries can come together and sit together and work together, you know, both the scientific community, but also the decision makers, you know, in order to really to take the most appropriate, I mean, decisions, you know, across these threats. And this is probably not the last variant that you will see. This is a kind of natural history of the viruses. They do mutate all the time. So it's really up to us to define the best ways. And the international health regulation, the recommendation of the whole World Health Organization can really help us to have a kind of more, let's say, really more rational discussion and to guide us, I mean, for the future.
Great. Thank you so much for your insights. That's Dr. Balde from the World Health Organization Africa office.